I'm going to say it now and I'm going to say it again, and somebody's going to ask, and you guys can help remind folks. We will be offering the recording and the materials after the training. So we're going to email them to everybody, and we're going to post them on the website where we do after all of our trainings. So fear not. And if any of your colleagues don't make it, we're gonna send this out to them. So please, just, you guys can simmer for a minute. We're gonna just take a few minutes while folks are rolling in. So grab your coffee, water, bathroom, chocolate, whatever you need. Okay, a few more folks rolling in. Happy Monday. How is it February? What is happening? Right? All right. So we can probably get started. So just a few housekeeping things. Hi, welcome everyone. So if you don't know what training you're at, because I know we have it set up this year as like trainings for 2025, so that you don't have to keep track of multiple threads, multiple links. Today is about housing first. And it's an interesting time to do this training while they're kind of like, we have 52 card pickup of the federal government, but this is all still relevant. Because this is really our philosophy locally, and you're going to learn. If you don't know what philosophy I'm talking about, you're going to learn. A few housekeeping things. So we're going to ask folks to put questions in the chat as we're going, unless the presenters are saying, you know, it's officially time for questions. We're going to ask you to use your virtual hand, or if you can't figure that out, like if you come on camera and wave at us, we're going to try and look for you, or you can put something in the chat. We're also going to ask folks to mute themselves. So sorry, I'm going to be shut it down, Sally, and mute folks if you accidentally unmute, because it gets really chaotic with a bunch of, folks with noise in the background. The other thing I'm going to do is I just launched a little poll. So we like to figure out who is in our trainings and make sure that who we're training and who our providers are representing the population we're serving. So these are anonymous. You are welcome, especially for the first question, which is what best describes your race and ethnicity. You can pick any that apply, so definitely don't have to pick just one. Second question is, have you experienced unsheltered homelessness within the past 7 years? Third is, what best describes your agency? So like, what kind of services do you guys provide? And then the last one is, what best describes your role, you as an individual? And this just helps us get a sense of like who's here, and also keep track for data around who's coming to our trainings. So I'll let that simmer for a minute. But if you go to the next slide, I'll keep talking while the poll's going. Just a few training norms, and we go through this every time. So we ask folks to, as always, respect the trainers, respect the attendees. And 3 and 4, make space, take space, and share the mic, are really about being conscious about how much space or how much you're engaging or not engaging. So like, I'm a big talker, so my challenge is to make more space, but for other folks, this is a good opportunity to maybe challenge yourself and ask a question. And then, as always, acknowledging power and privilege. And this can cut in a bunch of different ways. But think about race, ethnicity, your role in your agency, age, all sorts of different ways. Let's go next slide. So just a quick snippet about these trainings. So if anybody's new, we do these trainings monthly, and we cover a variety of topics. And when I say I'm Jamie Jeanette. I am with Health, Housing, and Homeless Services. We're kind of like the conductors for our homeless system of care, at least the team that I'm on. We have another team that does direct service, but we have a whole team that's kind of helping facilitate and keep all the pieces moving in our system. And one of the things we do is offer trainings on required things, required either by our funders or what we've decided in our community. We host them pretty much the second Monday of every month from 10 to noon. If you've registered for this, then you're going to get remindings for future reminders. And they are required for direct service staff and program managers, but they are also open to anyone. So if you know anybody that wants to learn about any of these things, they are welcome to come. Next slide. Okay, so as I said, a few of them are required. So like this one today is required. So glad you're all here. And some are, we also do some set ones that are maybe for different kinds of staff or different kinds of programs. And Shelby usually is in touch with agencies about those. Next slide. Shelby's not here, but wanted to just do a quick reminder that like attendance by agencies is monitored, especially for these required ones. And so if, you know, an agency doesn't have anybody showing up, Shelby's going to just check in and strongly encourage those providers to come. And it's a thing that we're tracking for all agencies, including ourselves, across the system, just to really make sure that everybody has the information they need to implement programs the way they need to be implemented, with the ultimate goal of getting people through our system and housed. Next slide. Okay, with that, I'll just do a quick set of introductions for the Health, Housing, and Homeless Services team. So I'm Jamie Jeanette, I'm the Community Engagement Specialist. And I don't know if there's anybody else from our CoC team that's here that wants to introduce themselves, or our coordinated entry team. I know we have Stephanie here. I don't know if Mary's here. Feel free to just say hi.
Hi, everyone. Good morning. This is Stephanie from Coordinated Entry.
Great. Okay, with that, I'm going to turn things over to Home Base, who are our trainers today. We have Nicole Johnson and Alex. Michelle, and I will turn it to
Thanks, Jamie. Hey, everyone. Good morning. Yeah, my name is Alex Mitchell. My pronouns are she, her, ella, and as Jamie suggested, I'm with Home Base. I'm here with my colleague, Nicole Johnson. Nicole, do you want to wave somewhere? Thanks. And then I'm also here with our colleague, Riley, who will be supporting us while we do the case studies in our breakout room. So Riley gives a little wave. All right. And so for those of you who don't know, I'm sure you all have come to many of these trainings, but Homebase is a nonprofit technical assistance provider, and we provide communities with support and strategies for addressing homelessness. And with H3, we support them in various ways, including providing some of these trainings. So that is why we are here. All right. I think a lot of you have already started to do this to introduce yourselves in the chat, which we are so grateful for. There's a lot of folks here, and we're excited to see that. And we love that you all are engaging already. So thank you so much. If you haven't already, please continue to introduce yourselves in the chat. And then, And then we are also going to do a little Mentimeter activity with these two questions. So I'm going to stop sharing my screen. And I think Nicole put it in the chat of how you can access it. You can you can scan the QR code on your phone if it's accessible to you, and that should take you there. Or you can also go to menti.com. And so let me stop sharing the screen so we can get the Menti up. And Nicole, I just want to make sure that you will be bringing that up, right?
Well, not able to see the screen.
I can see it's showing us
we can see it.
We can see it.
Yeah, I think now
it went away.
Now we can't. I forget this new feature on Zoom, how you can have the meeting view or the person who's sharing their screen. That was on the wrong one. Thanks, Nicole.
What we're seeing right now is, did you attend the last Contra Costa Home Base Housing First training?
Yes, so it's looking like a few yeses and a little bit more no's. So this is great. If you haven't attended one, then you're here today. So we're happy that you're here, and hopefully you find it helpful as well. And this next question is, have you participated in any other Housing First trainings? Sounds like some yeses and a few no's. So again, it seems like we're in a good place. Just give it a few more minutes. Or sorry, second. Looks like folks are still responding. All right, I think we can go back to the slides. Let me pull those up. Okay, cool. So thanks everyone. We are gonna keep things moving. All right, so why are we here? Jamie J already kind of explained a little bit of this, but we're really here because everyone has an important role to play in ending homelessness. Y'all are doing the hard work out there, so it is important for us to be, on the same page in terms of like what models to follow, and Housing First really is one of those models. And today we hope that we can provide you a preview with what that looks like and give you some practical tools on how to implement within your program. So let's go to the next slide. So like I said, yeah, today's goals are to enhance everyone's understanding of Housing First principles, identify strategies to overcome implementation challenges. We want to be transparent. We know that Housing First can sometimes be difficult to implement. So we're hopeful that some of the strategies and techniques that we offer you today will help to address some of those challenges. And again, to equip ourselves with actionable tools and resources. All right, so we have, before we jump in and to talk about what Housing First is, we want to do this check-in question. And again, we're going to be using Menti, so you can either scan the QR code or you can go to menti.com and input this code. So that should take you back there. And the question is, what is your understanding of Housing First, and what challenges have you encountered with implementing those principles? So I'm going to stop sharing my screen. I'm going to let Nicole share the Menti activity so we can all see it. Awesome. Thanks, Nicole. All right, so we're getting quite a few responses. Getting someone housed as an essential need to get them healthier, connects various clients with housing options, provide housing to the unhoused without sobriety or employment or other prerequisites. Then to place clients into housing and then work on other needs, helping clients to get housed first and then work around all other social needs. Perfect. Oh, thanks. So supportive services, programs that provide housing and support services, an organization that helps to promote cultural relevance and responsive trainings to service providers. All right. Thanks, Nicole. So there's a lot of different things. I've seen a couple that have come up as I don't know, or I'm not sure. So this is great. We will be talking about this. So hopefully you leave today with a better understanding of Housing First. Thanks, Nicole. Okay, I'm going to go back to share the slides. Sorry, there's a lot of screens open, so forgive me if you see me looking between multiple slides or screens. All right, so we're going to start off. We're going to jump in into Housing First basics. And so I'm not going to read this entire thing, but I do want to read the first sentence, and this is by Anne Marie Olivia, the Director of Office of Special Needs Assistance Programs. This is from 2016. And they state, Housing First is an approach where homeless persons are provided immediate access to housing and then offered the supportive services that may be needed to foster long-term stability and prevent a return to homelessness. So really the idea here is that permanent housing is the necessary first step in helping people address physical, mental, or behavioral challenges. And so really Housing First is calling for people to get into housing as quickly as possible without having to jump in through any hoops. And so the idea is here that once someone is placed or goes into housing, then they can begin to connect, or not begin, but then they can begin to address different issues that they may be experiencing. And so we'll talk a little bit more about this in a few slides, but Housing First, unlike traditional housing readiness models, doesn't require for people to be housing ready, right? It's rather, instead, it's through the Housing First model is recognizing that it's much easier for folks to work on other personal goals or, gain stability once they are in housing. So that's really at the core of Housing First. All right. Slide. So here are some key concepts of Housing First. One of them is, homelessness is primarily a housing issue. So the solution, to this is housing, right? So it might seem obvious. And for those of you who've done these trainings or are familiar with Housing First, may already know this, but homelessness, for a long time, homelessness was treated as more of like a personal failure or a set of issues to fix before someone could get into housing or before someone could get housed. But Housing First really flips that thinking in that if someone is unhoused, the first step is getting them into housing and getting them stabilized. So the other concept too is that the sooner people are unhoused, the better, right? So the goal really is in Housing First is to get people into housing as quickly as possible, so that once once they have that stability, they can then focus on what's next, and that can be finding a job, that can be addressing health concerns, rebuilding relationships, things like that. And so also Housing First acknowledges that it's easier to work on personal challenges and underlying issues from a place of stability. I think I've said this already, but it does, it's worth repeating. You all are service providers, and I'm sure you've all witnessed how difficult it can be for folks to manage, whether it's a chronic illness or behavioral health conditions while living in a shelter or living on the streets. So when someone is housed and they have a safe space, they can really then focus on their well-being and really making supportive services much more effective. Lastly is that everyone is housing ready. We'll talk, as I said, we'll talk a little bit more about what this means. But under the Housing First model, there really aren't, everybody is housing ready. There are no prerequisites to being able to go into housing. So that are some key concepts for Housing First. We're gonna keep going. This basically says what I just said in the previous slide. It's just in simpler terms. So to summarize, through Housing First, it means that participants are housed and are given supportive services without needing services or treatment first. Participants are supported in ways that meet their individual needs. So services and housing plans are person-centered, right? Participants are not terminated for not complying with their service plans, and participants are not required to take classes before being placed in housing. So these are simple terms of what Housing First is, right? And at the core of this is that services and housing are person-centered. So, all right, the next slide is what I've referenced already: housing readiness versus Housing First. So this is a nice diagram that shows, or a nice graphic that shows kind of the difference between that. So in the top portion, you see a typical housing readiness sort of model. So it's what we can also call as like the staircase model, or which is basically, it's a traditional model approach to solving homelessness, where really it's taking the approach that someone should be housing ready before they can be connected to permanent housing. So what that means is that there could be requirements for having income or for being in treatment. Yeah, so it's this idea that you have to be housing ready in order to achieve permanent housing. With Housing First, it kind of flips that on its head, right? And it's the idea that everybody is housing ready, and that being in stable housing is a necessary and a necessary step for folks to be able to then work on overall well-being and other challenges that they may be facing. All right. And so to give you a little bit of context in terms of like where Housing First came from, its originator, I may butcher their name, but Dr. Sam Semberis got the idea when doing outreach after asking folks what services did they need that they're not getting. They would say, like, folks would say, like, I need housing. That is the number one thing I need. Like, so in the late 80s, early 90s, Dr. Sambers took a risk and they piloted a project that put folks in housing with supports to see if it could work. And the pilot was very successful. 84% of people were retaining housing after 5 years. So it proved successful, and its Housing First has become a model, and it's become a model that is often required for different funding programs. So that is a little bit of the history of Housing First. All right, so next we have here, Housing First equals access and support. You might be thinking, like, what does this actually look like in action? What does Housing First look like in action? So in this slide and then in the next couple of slides, we will go over some concrete steps that programs and continuums of care can take to make sure that Housing First is being put into practice. So in this slide, we tried to answer the question, what would you see if your community or your services were using a Housing First approach model? And so here you have a few different things. So one, all programs would have lower barriers. So that includes shelter, it includes services, it includes housing. And then the most vulnerable, including folks with complex service needs, disabilities, mental health, or substance use challenges, are prioritized for and admitted to shelter and housing programs. It would also mean that housing-focused services and engagement begin immediately, but not waiting to housing, right? Like, they begin if you're an outreach worker and you're, meeting clients out in encampments. It means that you're starting housing-focused services immediately while folks are out on the street. It also means that we need to increase supportive services, right, to help gain and maintain housing. So getting people connected to those wraparound services. Again, as I've mentioned this before, but services and housing should be client focused and voluntary. So folks should be, when you're writing case plans, folks should be writing those case plans with you as a case manager, right? Like, making sure that you're listening to folks' needs. And a really important part of this also is that services should be voluntary. That's a really important piece here in Housing First. And then programs engage in evidence-based practices. So there's a range of them, but we can talk about harm reduction, trauma-informed care, motivational interviewing, and other evidence-based approaches. The goal is for these programs and services to be practicing around these evidence-based practices. And then again, lastly but not least, client choice and voice are engaged and respected. As I mentioned earlier, it's really about getting folks, clients to be active and participating in the services that they need, that they really need, and that would help them get to a better place. But again, it's client choice, and they should be voluntary. All right, go to the next slide. So in this slide, these are characteristics of Housing First programs. I'm going to go through them. I'm going to try and keep it brief. So we have First one is few or no barriers. So that means access and participation are not contingent on, for example, sobriety, income, lack of criminal record, completion of treatment, or anything like that. And then also households are not rejected or terminated on the basis of poor credit or financial history, poor or lack of rental history. We know that folks that are experiencing homelessness often have breaks in housing, and so that shouldn't be considered for rejection or termination. And then we also have reasonable accommodations. So persons with disabilities should be offered clear opportunities to request reasonable accommodations within the application and in the screening processes and during their tenancy if things change. And then we also have identification of alternatives. So if programs cannot serve someone, they should work through the coordinated entry system to process and to support to support the household in accessing any housing and services elsewhere if the program is not unable to serve them. Again, the programs and services should be voluntary and they should be client driven. And then we also should consider flexible payment options. So tenants are given reasonable flexibility in paying their share of their rent. And then we also have eviction prevention. So substance use, other behavioral health challenges without other lease violations should not be a reason for eviction. And it should be stated that every effort should be made to mediate any disputes and maintain and help folks maintain their tenancy. All right, so a question that may be coming up for folks is, okay, so this is housing first, but how do you actually create a housing first system? Here we have a few different things that we think are practical ways in which you can do that. One is uncouple service provision from leases or tenancies. So in housing first, housing is not contingent, as I mentioned before, is not contingent on participation in services, but people should be able to stay in house regardless of whether they engage with treatment or other supportive services. Another thing is that programs should examine rules, both written and unwritten, within programs, but across systems, right? So it's important to take a look at both formal and informal rules that might unintentionally create barriers for folks. And then we have alcohol or drug use without other lease violations is not a basis for exclusion or eviction. I talked a little bit about this earlier, but making sure that these are not, that substance use is not a basis for exclusion or for evicting folks. And this sort of goes along the lines with harm reduction, implementing harm reduction and trauma-informed care. And then we also have providing system-wide support to lowering barriers. And so a system works best when barriers like identifications, verification of income, or any criminal records are reduced or eliminated. This may require adjustments in housing policies or collaboration between systems to ensure that people can access housing easily and quickly. And then we have ensure that leadership, managers, and staff understand and have tools to implement housing first. So we're hoping that this training is, contributes to that understanding. And then instituting program and community-wide monitoring. So this ensures that the system is working as it is intended, that regular monitoring and evaluation should be in place. This can include tracking housing retention, access to services, and overall success of individuals that are flowing or going through the system. Oops. Oh, there we go. All right, so here, to create a housing first system, we must ensure that everyone, regardless of their background or their circumstances, has equal access to housing. And so this really brings us to such an important piece of this, which is that housing first is not just about housing, but it's also about equity. So Housing First fights against discrimination and exclusion, and that the people facing systemic barriers like racism, sexism, disability discrimination, uh, we want to make sure that they aren't further being marginalized by complicated eligibility requirements or exclusionary practices. So Housing First addresses that. It also prioritizes the most vulnerable. So the approach is designed to help people who are most at risk and marginalized, ensuring that they have equal access to housing and support without being penalized for their circumstances. And then it recognizes that everyone deserves a home, regardless of their background or challenges. Everyone has the right to stable housing. And it's about removing those barriers to ensure that there's an equitable access for everybody. All right, so, oops. Okay, so necessary equity components. So Housing First, as I said, promotes equity by removing discriminatory barriers that prevent marginalized populations from accessing housing. Um, and this is how it works. So we have equal access. So that ensures that all individuals, regardless of their background or circumstances, have equal access to housing. No eligibility requirements. This prioritizes immediate access to housing without preconditions or requirements, as we've talked about this over and over again, such as sobriety or participation in treatment programs. Also with anti-discrimination policies. So this prevents a bias and ensures fair access. It is important to train staff on fair housing practices and implement non-discrimination policies and actively address instances of discrimination. And then we have culturally competent services. So it is important to understand and respect diverse cultural backgrounds, languages, and traditions to ensure that individuals receive appropriate and equitable support. This can mean, making sure that you have folks that speak languages that are predominant in your community, making sure that your documents are provided in those different languages as well. And then outreach and engagement. So engaging marginalized populations in a way that's respectful, that is inclusive, and really collaborating with folks to ensure that housing resources are accessible and available to all. All right, so we started this conversation with the question of what is Housing First? And now we want to talk about why housing first, right? Well, to start, it is evidence-based. So studies throughout the US and Europe have shown that following a housing first model increases housing stability, and it is most effective at ending homelessness. And something I mentioned earlier is that a lot of funders in the community have made housing first a priority. So we got to follow it, right? Especially if it's required by certain programs. Many of y'all are familiar with CoC, so that's just one example. And then lastly, but definitely not least, it helps people. It helps communities build more effective, more cost-effective, more successful systems of care, and that really work towards helping to supporting and better serving people that are unhoused. So there's lots of whys. I would love to hear from other folks what their whys are, but I'm sure that they're a diverse range of whys. But if you want to put that in the chat, you're more than welcome to. But I'm now going to pass it on to Nicole, who's going to lead us through a couple of activities and the rest of the training for today.
Thanks, Alex. We can go to the next slide, and we are going back to that Mentimeter, everyone. Okay, so we have another activity, and we are going to just look at a couple of policies, look at some language, and see if we can identify the parts that don't support the housing first principles based on what we learned today. We can go to the next slide, the first activity slide. So permanent supportive housing programs participants rules state that management won't consider tenancy of an applicant if that person has ever been arrested. And so in the Mentimeter poll, let us know whether or not you think this policy complies with housing first. And you can just check yes or no, and we'll make sure that we go through and show you the correct answer. And then we'll pose some discussion questions.
Nicole, folks are having a little trouble hearing. Is it possible for you to speak up or be closer to the mic?
Volume. Is this better for everyone?
It
Alex,
is
are we
for
getting-
me, but I'm looking to see in the chat.
It's
if
good
people-
for me too.
Okay.
Okay, perfect. Thanks. Sorry about that, everyone. All right, I'll give it like 2 more seconds for people to respond about whether or not they think this policy complies with housing first principles, and then I'll go ahead and show you the correct answer. All right.
Folks are having, let me grab the QR code. Folks are needing help getting back to the,
Oh,
back to Menti. Okay, let me see if I can do it. Okay, there we go.
There's a link in the chat too.
Okay, there's a link in the chat and I just put the QR code back in the chat.
And if you all are ever having trouble with the Mentimeter on the screen, you should see, you can join at menti.com, menti.com, and enter this code if you just can't get through with the link for any reason. So the answer to this one is no. This particular policy is not in alignment with housing first principles. And that's because, again, think about housing first. We want to make sure that we are eliminating barriers. So if we're adding the requirement that the applicant has never been arrested, we're going to exclude a lot of people who may need to come into housing. And I know some of you may be automatically thinking about some of the like program restrictions that talk about convictions and criminal backgrounds and, you know, different types of offenders or previous offenders who may have things on their records that won't allow them to be in a specific unit. I'm thinking about, you know, at the top of mind, people who have had to register on the sex offense registry. And a lot of times there are restrictions for where somebody who's registered on the sex offense registry can live. For example, depending on their registration or their conviction, they might not be able to live within a certain radius of children. And if it's an apartment building with children, they can't live there. But this specific rule says that the person has never been arrested. It didn't say convicted. It didn't say what specific crimes or issues, in a way that we could make this more low barrier or comply more with housing first is to have that specific language in there to make it more general. So we're not keeping everybody who's ever been arrested out. We're saying that, you know, we could take this whole rule out and it could just say that management will review applicants, you know, as they come in. Management will review every application individually. So we're not going to have this like hard and fast rule that if you've been arrested, you can't come in. We can go to the next slide. All right, y'all are moving fast. All right, so our next policy is, sorry, just a moment, my mouse stopped working. All right, our next policy is the rapid rehousing program participant agreement. Says that the participant has to agree basically to this rule to receive their housing. The tenant agrees to take part in the supportive services provided through the Shelter Plus Care program, including but not limited to meeting with the case manager, primary support service provider at least once per month. Go ahead and enter your responses in the Mentimeter. Do you think that this complies with housing first principles or no? and some of the things to think about. What goals might this program be trying to support with this particular rule, and whether or not these goals can be met by different rules. Remember that housing first is low barrier. So we want to take out all the criteria that's going to make it more difficult for someone to receive housing. And we'll give it a few more seconds before we go ahead and show the correct answer. Right. So the answer again here was no. This particular rule did not align with housing first principles because it is essentially requiring the participant to participate in services. Now, as a provider, yes, we want folks to get the case management. We want people to meet with us. We want people to work on goals, but making that a requirement for somebody to sign and say that, yes, I'm going to show up every month. Yes, I'm going to meet with this provider just to receive housing creates the barrier. And that's like the opposite of housing first. Housing first would have us to suggest that people come to these meetings, suggest that people meet with their case manager, but it wouldn't be the requirement to receive services. We can go to the next slide. And I'm going to end my share so that Alex, you can bring the training slides back up.
Nicole, there's a question in the chat. Somebody is wondering if they can ask for clarification.
Absolutely. Do you want to come off mute quickly and we can go through that?
Good morning, everyone, and thank you. I just kind of wanted a little bit more clarity. I understand that folks can't be mandated to participate in services, but I got stuck on the word agree. So it doesn't mean I don't associate agree with mandating or required.
Thank you for that question. That was going to be my point. You're taking all my talking points here.
I'm sorry.
No, it's a good thing.
I'm also guilty of, you know what I mean, in our things. It's
yeah.
Okay.
Yep, it's a good thing. Thank you for that question. And just a little bit of context, I was not always an attorney here at home base. I was a clinical social worker for a couple of decades, ran shelters before, housing first was housing first, when we were all just out here kind of doing our best to make things happen. So the information I'm giving to you is coming from me doing the same things too. It's not just going to be us saying, oh, you've been doing it wrong. We get the intent, we get that there are goals here. So the reason having the tenant agree to something like this is not aligned with housing first is because of the power dynamics. We as providers, we have all the power here when you're talking about somebody having housing and not. So if I, as your case manager or provider in general, just say that I need you to agree to something before I can give you this housing and you need that housing, you're more than likely going to agree to it. So although we're not using the word required, the feeling is still that it's required on the part of the participant. Is that landing for folks? I'm seeing some heads nod. Okay, perfect. Thank you. And so this brings us to implementation challenges. We can go to the next slide. So some of the challenges with implementation we know are just the housing costs are steadily increasing. They're not going down. It's getting harder and harder for people to be able to afford housing. There's not enough housing to go around. There are what I call acceptable discrimination, and that is when we just exclude folks as housing providers, not us, so like landlords, private property management companies, they are essentially discriminating. So saying things like, I don't accept vouchers in my building, or I don't accept people who have sketchy backgrounds. I don't take people who are not employed. Those are all different forms of discrimination, whether it's based on income, criminal background, and it's socially acceptable to say no to these type of applicants. And then also another big challenge is the capacity to serve people with complex needs. I like to, not sugarcoat things and just be direct. The reality is that housing first, if we do it the way it's intended to be done, housing first requires us to take the people who need the most help. And just realistically, our programs typically don't have the capacity to serve people with complex needs, everybody, all at once with the limited resources that we have. And so the very real question that we hear from providers when we're going around the country doing this work and talking about housing first is that I can't do this. I can't take in all the people who are actively struggling with addiction because I don't have the capacity to serve them. I can't take in all of the people who have very serious mental illnesses and they're not being treated. And so I'm dealing with psychosis. I'm dealing with somebody who is, coming down because they kind of went cold turkey off of whatever they were using. I'm dealing with all of these people at the same times, and I just don't have the staff. My staff don't have the training. We don't have the tools. We can't do it. So those are the very real challenges that we know exist. And we don't want to come here and pretend that those are not issues. We just want to acknowledge that they are there. And we can't change any of that. But what we can do, and what I would like to encourage you all to do, and I think it's safe to say that some of you are probably doing this already, is trying to think creatively and outside the box about the things that we can change. So some of the things we can work on when we talk about the limited housing supply and the increasing housing costs is landlord engagement and tenant education. So when we think about our private landlords, their goal is not to end homelessness. Their goal is not to get people off the street, not to get people housed. Their goal is to rent out their units and make money because they're running a business. And so to do that, they need to maintain their property. They need to collect rent. They want to make their jobs as easy as possible. So they don't want our clients with complex needs. They just want somebody that's going to come in, take care of their unit, and pay their rent, right? And so one of the things that we can do to help kind of mitigate that risk for them, because it is a risk, is to build the relationship. We strengthen landlord engagement. We go out and we talk to people. We make sure they know that, yes, this tenant is coming in with no money, but they've got this voucher from us and that rent is going to get paid. We've got them connected to services so that rent is going to be paid. If they, are having an issue where you're feeling like as a landlord, you just can't manage or it's making your job too hard, here's the phone number of this case manager. You can call us if you're having trouble. So things like that can sometimes help strengthen landlord relationships and make property managers and landlords feel more comfortable with renting to the people that we're trying to serve and get housed. The other side of that is tenant education. So a lot of times with tenant education, it's often limited to just like talking to people about their rights, when and how their landlords can evict them, or the things that their landlords or property managers have to do to give them like safe and housing that is within compliance to the different housing codes. That can also include supporting our tenants and our program participants with teaching people what it means to be a good tenant, how to communicate your needs to me, your case manager, before things start to spiral and get out of control. And for a lot of people that, talking about people who, for example, have experienced chronic homelessness or some very serious health conditions, that might look like finding out what it is they need to maintain housing once they get there. So one of the things that stood out to me a lot when I was managing a shelter was that I had a lot of people who would come in and they had been like in foster care their whole lives, and they aged out of the system straight into homelessness. And some of them were now parents in a shelter, and they had never lived in their own apartment or in their own home. They had never been anywhere long enough where they had like a closet and a dresser and places to store things. They were accustomed to living out of suitcases and trash bags. And so when they got their units, it would very quickly become cluttered and messy. And the landlord was complaining because it was a mess when they tried to go repair things. And what we learned was that they just never learned how to take care of an apartment because they never had one. They never learned how to make plans to do their chores and manage school and manage work and manage parenting because they never had to, and they never got that guidance. And once they got that level of education that, went from outside of our desk and offices as a case manager and really into their lives, into their units to help them figure out the thing that they needed, it was as simple as teaching them how to fold clothes to fit in the dresser drawer, or giving people hangers and closet organizers so that they could fit all of their things in their small closet and not have it be a mess. really simple solutions that sometimes just get missed when we're doing all the things that we need to do to help somebody. Sometimes we just need to talk to them. Sometimes we just need to go visit that unit and see what it looks like and see if we can help identify the problem. We can go to the next slide, please. So more about practical solutions. These are the buzzwords that we talk about a lot, wraparound community services and community partnerships, harm reduction, a person-centered approach. But practically, what does that look like? For me, it starts with the households who have the highest barriers to housing. So it's going to be the most vulnerable people. It's going to be the people who are having the highest impact in the community, and those who typically wouldn't exit homelessness without some help. So these are the folks who need something when we talk about people with complex needs. When we talk about a participant-centered approach, we're talking about, again, eliminating unnecessary rules and requirements. So practically, that might look like going through our program's rules and seeing which of those can we change, which are creating barriers for those people that we just described that have the most needs, the more complex needs. What goals are we trying to accomplish, and how can we reword this rule or this policy to still accomplish our goal, but make sure that we're able to support as many people as possible? We also want to implement the strength-based approaches to empower our participants to have more autonomy and independence, and challenge the idea of what the non-compliant client looks like. And so maybe it's not that somebody is just lazy or doesn't take it seriously or doesn't want to meet with you. Maybe they're just tired of meeting with people because you're not the only caseworker that they have to go tell their story to and open up to, and they're just maybe overwhelmed by that. Or maybe it's a situation where they're just tired of hearing all the things that they're doing wrong or talking about all the things that they can't get right, and they just need us to say, you know what, you came here today, thank you for showing up. Or I see that you have been getting to work every day on time. I'm so proud of you. That tells me that you can do things well. You can manage your time. You have some good things going on. Tell me, what's going on well in your life. Just really taking some of the what can feel more clinical and going through the checklist and going through the motions and really talking to people like people. I like to remind folks that and I had to remind myself this too when I was practicing social work, is when I'm talking to the person across the table, my 10th person of the day is the end of a really busy week. Everything has kind of fallen apart, at work, as things do. But how would I talk to this person if it was a family member experiencing homelessness? How would I talk to this person if it was a close friend experiencing homelessness? Like, how would my tone change? How would the things that I'm willing to do or the way that I'm willing to see them as a person change? And that's just something that's been helpful, for me as a practitioner, when I'm overwhelmed, when I'm tired, when I'm exhausted, especially that one client that just, touches that nerve because you do all the things and it seems like they don't want to participate, or they get stuck, or they repeat patterns or negative behaviors, is what would I say if this was my child? What would I say if this was my child's friend? So that kind of reframing, at least for myself, has always helped to just see people as people, and be able to pull something positive about their situation out and empower them to move forward and take the next step in accomplishing their goals. We can go to the next slide. So some common community-based supports that are just as important as some common community-based approaches that are just as important to implementing housing first as the day-to-day case management is reaching out to those community folks. So the faith-based community, even when there's not a religious affiliation, a lot of time the churches in the community, they are doing good work. They're able to connect with people in a way that we as providers cannot. They are out there literally living right next door to the people that we're trying to help, and they can be amazing resources. Identifying the groups that are helping do work for identity-based communities. So there's going to be a group or a task force or a community-based organization that's specifically working with different social groups. So the LGBTQI community, there may be somebody that's focusing on different ethnic groups. Maybe there's a program that's focusing on helping BIPOC kids, or there's a program that's focusing on immigrants in that community. You want to go to those organizations and talk to them, find out what services they're offering, find out how you can get your people connected to their people so that folks can have support within their own community, and from people who are going to be really focused on the unique needs that they may have. Another thing we want to think about is programs for households with aging adults. So programs like adult daycare, senior citizen services, senior centers, they offer a lot of supports for our seniors. And we know that the aging adult homeless population is starting to grow. So that's a subpopulation we want to look out for. Another community-based group is we want to look for programs that specifically target children and youth. So I'm talking about childcare centers, after school programs, tutoring services. And sometimes there are, the big services that we think about that are through like the rec center or the school or a small nonprofit, but there are often organizations like Divine Nine, Black Greek letter organizations. Almost all of them will have programs that specifically target youth. There will be mentorship programs. There will be economic empowerment programs for their parents. So there are different things in the community that if we as the providers get to know, we can connect our folks to those services, and then they're able to build their own community and pick and choose where they get services. It doesn't have to all fall on us. There are a lot of nutrition, education, and counseling programs, support groups for people, whether that's loss and grief, recovery, even single parenting, and then legal help. So we want to reach out to our local bar associations and see where we can find an expungement clinic or a housing clinic to help somebody clear an eviction and not have that on their record, so that they are able to go and get more housing later on. And then we also want to, teach people how to go get services themselves, again, so that it's not falling on us. And when things happen later on in their housing journey, they know where to go to get help so that they're not falling back into the pattern of experiencing another stint of homelessness. We can go to the next slide, please. So this is just an example, a visual of what the person-centered approach is. Again, we're eliminating unnecessary rules. We're being clear about what's required from participants and what our recommendations are. We're implementing strength-based approaches to empower participant autonomy and independence, and we're challenging the idea of the non-compliant participant. We can go to the next slide. And now the really fun part, we're going to jump into some case studies. We're going to bring up a few breakout rooms for people to self-select whichever group you identify with the most. And this is going to be based off your role, what you do for work. And when you get into those rooms, we are going to give you a few scenarios, and basically, we can go to the next slide. And basically, you're going to read through the scenario with your group. You're going to answer the discussion questions together. It's okay if you don't finish each scenario. You can go through however many you can get through in your group. If the discussion gets really good at scenario one, don't worry about going to the next one. Just go ahead and talk through that first scenario. The goal here is to just start talking and sharing experiences, approaches, because we really value that peer sharing. You all are doing the work. You all know your community better than anybody else. And a lot of times what happens in these kind of discussions when we're going through scenarios is people will be like, oh, there is this group and it works amazing for this kind of person. And then people will start talking about all the different programs that work, the different providers that are great. So if something comes out, take notes. We are going to make sure the room options pop up as shelter and care center staff. Housing staff is another option, outreach staff, and then other for everybody else if you don't fit into those top three. Okay. Do you have any? I'm
I
sorry.
was just going to say one more thing about the breakout rooms. So there's going to be for like shelter care center staff, there's going to be 3 groups with that category. You'll have the option about which group to go in, but please don't all pick group 1 if that's your category. We're going to try and spread people out. And also Riley, I think, is going to put the scenarios in the, oh, brilliant. There she is. the scenarios are in the link, and then we're gonna have a, excuse me, a whiteboard where as your group is discussing, you can put your thoughts in there. And when we get to the whiteboards, the first slide will be for that shelter care center group. If you're in the next group, you can actually just go to the next slide. So it might not make total sense, but we're gonna try it. It's gonna be an experiment. Nicole, tell me when you're ready for me to open the breakout rooms.
Yep, we're all ready if nobody has. any-
Okay. I'm also gonna try and open the whiteboards. Okay. Oh, Riley, it sounds like maybe the download isn't working. I don't know if it's,
If the download isn't working, I also attached a Google presentation slides. Hopefully that
got
works.
it. So the thing I'll say about the breakout, I mean, the whiteboards is like, you're gonna use these little sticky notes. I don't know if this is showing, but, okay, so are folks seeing the different room options? If you're having any issues, raise your hand or unmute, and we're gonna try and troubleshoot.
I don't
Not
see
seeing the room
op-
options.
Oh, that's interesting. Okay, let me try stopping with the whiteboard. Okay. How about now?
No.
This is weird. Okay, hold on. Allow participants to choose rooms. I don't know why this is not showing. Okay, hold on. Let me try again. I'm gonna,
I do see some people are able joining the breakout room. So
oh,
for those who aren't seeing it right now,
thank you.
go to the bottom of the dashboard on Zoom, and maybe you have to click on the More button, which has the 3 dots, and then there should be a tab for breakout rooms, and then there'll be quite a few rooms, 10 rooms to choose from that fit what you align with. And
Doing-
yeah, if it's not coming up for you, maybe we can help assign you to rooms. Did that explain it?
And Dion, I see your hand up. Are you struggling to find a room?
I am
Okay, what category are you?
housing.
Okay, I'm gonna try and move some folks manually. Okay,
You choose 1, 2, or 3.
all right. So then, okay, good. Anybody else need me to yeet you into a room of your choice? Okay. So put into the chat, put what category you want, and I'll just try it that way. Ricky Lynn.
Reentry.
Okay, so we don't have reentry, so I'll put you into other.
Okay,
Okay.
thank you.
Let me see how to do this. Hold on 1 second. Okay, send to other. Great. Okay. Okay, Carmela wants shelter. Okay, I'm gonna start to assign people that I know. Wanda. Sorry guys, this is not how it's supposed to go, but it is what it is. Right. Okay. Okay. Amber, there's a lot of others. Okay. Working on it. Let's see. And housing, like housing navigation, we're gonna put you in housing there. Who else? Amber. Okay. Other folks that are here that need to be put into rooms. Housing navigation. Okay, Aaron, we're gonna get you into housing. Okay, anybody else? I don't know why this is not working right, but. Okay, so for the folks that are still hanging out in this room, that can still hear me, either unmute and let me know what room you want to go into or put it in the chat. They also may be logged in and doing something else. Okay, Rebecca, I see you want shelter. Great.
Thanks so much, Jamie. I'm gonna start hopping into
Yeah,
the shelter
Okay.
breakout rooms, see how they're doing.
You want shelter, great.
Same, Jamie. I'm gonna hop into the outreach room.
Okay, great.
Thank you.
Okay, got Alexander, Renee, we're gonna get you into housing. Great. Okay. What else? Anybody else? Where can I send you? I feel like a travel agent. I'm gonna pause the recording too and set a reminder.
Well, good luck with your training and thanks for that little side chat. Welcome back, everybody. The recording is back on. I hope those conversations in your breakout groups were lively. We are going to spend just a few minutes sharing out. And we'll wait till everybody gets back in the room. I see folks are still trickling in.
Yeah, it gave them like 60 minutes to yank them all back in.
Welcome back, everyone. All right. I think we are all back together. Welcome back. Thank you for participating. We're going to spend just a few minutes sharing out. We can start with scenario 1 whenever Alex is back and ready. If you could share that slide. So just with scenario 1, if anybody wants to share out from their group, which housing first principles they thought came into play, you can drop it in the chat. You know, one person can come off mute and we can hear those principles out loud. And scenario 1 was, there we are. Someone's referred to a PSH program. They have a substance use disorder and they were recently discharged from the hospital. They're currently living outdoors while they wait for housing. And this person said that they're not interested in reducing their substance use. They're not going to stop using. What housing first principles come to mind for folks, or did you talk about in your group?
Client choice.
Client choice, thanks. Anyone else? Someone in the chat said they can't be denied housing, on the basis of substance use. Thanks you all. All right, any biases that people recognize in themselves as they meet with this particular person, or you think about how you might react?
Well, I have 13 years clean, and I've been on the other side, and it's very frustrating, even for me, that someone who should have more compassion at times. And that's why the housing first model is kind of sometimes, because it's like without that clear mind and without, I don't know how else to say it, without doing better, being better, and you're not full of drugs and all that craziness that goes along with it, you're really not going to succeed. And so it's so hard when I house somebody knowing full well it's going to become just the biggest disaster ever, because they not only don't want to stop using, they're used to it, they want it, and especially if they're housed, they're going to even go harder because they got somewhere to stay. So, I don't have an answer. I know I kind of always encourage people to go to a program first, try to get there, or let's get you housed and then let's get you treatment, my answer would be just to continue trying to help them, because there really is no answer if that's what they say. We cannot force them to do anything. I don't know if that helped anybody.
Thank you for sharing that. I mean, that's real. That's the reality that we face as providers, right?
It is, and it's super frustrating.
Housing first is hard. It's hard to
Very,
implement.
extremely hard, extremely hard.
But but offering peer support, because I am also a consumer of substance abuse programs. I would one of the things that I've learned is about motivational interview and being a hope. I call myself a hope dealer. And so we really walk close with people, so I take it from a different perspective, and I get you, that we look for, because we've seen people. That's what hope is. It isn't blind things. We see evidence because most of us are in evidence-based work for those type of programs. So what we do is we carry hope to the situation, and we really support them to map out goals, attainable goals. And it might be that they continue to use, but that is one of the focus, is that they're safe, their safety. And then with the motivational interviewing, we really we become these people who inspire them to see that this is attainable. You know what I mean? Small increments,
Absolutely.
baby steps,
Absolutely.
just like it was for us. I'm going on mute.
Thank you for sharing
I
that.
like that.
And that was going to be my point for this one, right? This is a tough case, and I know it's really difficult for folks to really wrap their heads around the fact that someone who is struggling with substance use is just not going to be able to maintain housing. The thing is, we know that this works. Like, Housing First is based on data. If you look at some of the studies that come out of Canada, some of the studies that come out of the UK, they are doing housing first. And when you talk about harm reduction, so making sure that people who are still struggling with substance use can be housed, they're getting clean after they get housed. So while we may not have seen it personally, it does work. And it works enough where there's study after study after study that shows us that it does. Now, in real life, our systems are very different from the Canadian homeless systems of care. Their social structures are different. They have different types of supports within the community, within their government structure than we have. But that doesn't mean that we can't replicate some of that. So the reason that Housing First oftentimes does not work for us the way it's intended to is because we don't have all the resources we need to do it. Like, we can't expect one case manager to go be the peer support specialist and the housing navigator and the counselor. Like, you can't do all of that, right? So it's not that Housing First doesn't work, is that our system oftentimes is not designed to give us the tools that we need to really support people through Housing First. But all we want to do is get folks in the door. And then the way that we challenge, or we kind of make up for the fact that our society doesn't support this model in the way that we wish it did, is we try to rely on those community-based supports. So maybe that's where, I talked about earlier, the churches. That's where you go into that person's community, and maybe you're knocking on the door of that local pastor, because they're typically running a program in that church basement, or they have somebody that's going to call and check in on them. They're going to take them some food every now and then and say, hey, are you eating? Are you safe? Do you have what you need? They're going to make sure they've got clean needles if that's what they're using. And over time, we hope that that person, again, is safe in their housing. And when they're ready, they have a soft place to land. They have the supports that they need. So it's definitely not easy. It is not always going to work, but we know that Housing First does work. There's a ton of data that tells us Housing First works particularly well for people who are still using substances and are not quite ready for recovery. Harm reduction, it's ridiculously good. Like, I don't know if you all can tell, but I got really excited about harm reduction. Like, it works. Housing First works. We just have to find all the resources to support. And for us as case managers, that typically means pulling in other people and trying to delegate some of that work off of us, because we don't have the capacity to do it all ourselves. We answered all of our questions. Look at us. We can go to the next slide. So scenario 2. This was another tough one. And I want to tell you all that these came from, like, real life. These are not things that we just pulled out of the public policy air. These are like real life scenarios that came out of trainings like this, focus groups that we've done in the past. But these are things that, other providers have brought up. Sometimes it's TA questions, like we get these questions from some of our clients around the country, and they're telling us their problems, and we're trying to figure out how to solve them. And the principles that are in play here are things that we see consistently enough where we thought this might be good, to throw into a training. So anybody want to chime in with any housing first principles that they thought about for scenario 2? And it's up on your screens too. I know I've seen this one 1,000 times, different issues, but 1,000 times. The problem tenant and they're missing rent payment. So not only are they not paying their rent on time, they are disturbing other people. Neighbors are making complaints, property manager and landlord, they're tired. They're just going to go ahead and issue this 10-day notice to pay or quit, which means, pay your rent or you get evicted because they're just tired of dealing with this person. Or any biases that you can think of that come to mind. And we're just listening here, not judging each other. Identifying our biases as providers is really helpful, and go ahead and implementing housing first. Mariah, I see your hand. Go ahead, please.
Hi, good morning, everybody. Oops, I didn't have my camera open. I think for me, one of the biases that come up, and this was actually my scenario, I didn't necessarily mention it in the group, but for me, sort of hearing the vulnerability in the last one, I felt like it was important for me to come share my sort of biases in this situation as somebody who was homeless as a child due to my parents' like choices and sort of circumstances and where they were navigating their own substance abuse. I feel like I really struggle at times with parents who have kiddos that are not necessarily always taking the important steps of being proactive in some of the things that are important for kids like housing, food, education. So I think for me in this situation, my bias oftentimes goes back on to like my childhood experiences where I'm like, I just hope that um, as a child, you can feel the love and care from your parents. And sometimes when you're always up and down in housing, don't have a stable home, that cannot that doesn't always feel like that's what's happening. So I definitely would say that my bias comes from my experiences and sort of how that plays out would oftentimes look like being more harsh on parents or not giving all the sympathy or empathy that I know that I can if it was just an adult by themselves versus an adult with kids. So I appreciate you guys sharing and asking us to sort of recognize our own bias because I didn't really realize I had a bias until we started talking about them.
Thank you for sharing that, Mariah. We really appreciate it. That's actually the reason I put this one in here. Kids. We all care about the kids and the babies, and it's something that we don't really recognize a lot as providers. But when those kids are being harmed by the actions of those parents, and when I think about this particular scenario, I think about the fact that they're in permanent supportive housing, and the requirement for permanent supportive housing is chronic homelessness. So in my mind, as a provider, you've been homeless with this baby several times, and here you are again messing up, and this kid is about to go through all this trauma again. So I've already got an attitude when I'm meeting with them. I'm thinking about all the things that they could have done differently, and I'm annoyed. So how am I going to treat them when they come to my desk? Is that a situation where I'm going to need to, again, bring it back and say, how would I respond if this was my brother? This was my uncle. How would I talk to him? What would I do? What would that conversation look like? And it really does, make you pause and change your tone and just try to hear them out. Does anybody want to share any solutions that they may have thought of for this one?
Well, our group came up with being more specifically supportive on a cognitive basis, kind of like meeting with the parent weekly for a month, and then go to bi-weekly, and then once a month. So sort of try to find out what has happened in the last 3 months that's bringing this on, because apparently they did okay for a year and a half or more. So try to approach it from trying to get what his perspective was, and then the other is to build on whatever strengths there are, join with them on a level of just personal interests. So you know, is he into sports? Is the child into unicorns? Whatever. So bringing some things to the table that are positive and a little bit tangential from the business aspect, but also that helps you to join with the person as an individual, and then once you've established, like reestablish him paying his rent on a regular basis, be sure that he knows who to contact when he starts dragging down again. If he feels like he's getting in trouble, he doesn't have to wait 3 months to ask for help. He can call me tomorrow, or he could call my supervisor tomorrow, whoever that is.
Thanks for that. One thing I think about, particularly with the smoking and the fact that, you know, they've been there for a while and this is just now coming up, what was causing the smoking? You know, again, PSH, is there a chronic health condition? Is this person self-medicating? Has something happened with whatever other support services that they used to have? You know, what questions can I ask to try to figure out what's going on? And then how can, you know, this dad and I go talk to the property manager? Is there a heartstring we can pull on to get rid of this 10-day notice? You know, what can we go communicate and talk through to try to get this thrown out so that we can stay in this unit and fix all the problems? So when we talk about, you know, being creative, it is literally being creative. And how will we deal with this if this was our adult child? You know, if this was a family member, what would we do to try to keep them housed and show compassion a different way and build on strengths a different way? We can go to the next slide for scenario 3. All right, and this again, PSH program, a married couple with a child. The father has a disability and can't work. Other parent is out of work for reasons that might be related to substance use. And the family's just, they're not being able to make ends meet. And now the child is getting in trouble at school. The parents can't afford like pencils and stuff. The kid's falling behind. You know, what are some of the things we're thinking of from a housing first perspective? What in your community could you connect the parents to? You know, how could we help them get work? Any long-term resources so that they could start being a little more independent and preventing these issues in the future? Because we know they're not going to away. They're not going to go away, right? Anybody want to share some resources? Anything specific to your community? Or anything that came up in your groups?
Hi, this is Athena from Bex. So this is one of our scenarios. I think some of the resources that we came up with, you know, if he is disabled, we could potentially connect him to SSI or SSDI. Maybe some legal resources that'll help him with that. If that's something that he would qualify for. We talked about the mom and her substance use, and that is, you know, she's out of work potentially because she's using, but, you know, kind of talking about building some rapport with her and trying to figure out if she is up to working. If not, is she up to, you know, going to treatment, or kind of, does she think she has a problem? Kind of just building that rapport and asking those questions, just to kind of see where she's at. The longer term resources, we talked about connecting the kid to some resources within the school. They usually have like a social worker, maybe some like an IEP program. You know, we don't know where he's at with his schooling necessarily, so I think the school is always like a good start to kind of just connect with, let them know kind of some of the barriers. Because they are in PSH, they potentially have some supportive services on site, so that can kind of help them connect with all of that. So That was kind of some of the stuff that we came up with.
Thank you so much. Anybody else?
I was in this group as well, and we also thought of making sure that he had school supplies and materials, so he can feel a part of like the other kids, um, sometimes going through these behaviors with his parents and stuff, and sometimes if you can just feel a part of in that atmosphere of school helps out a lot also.
One of the things that came up for me with this one is those community partnerships again, like reaching out to those relevant like identity-based groups within the community. Again, the churches, the rec centers, for the school issues and getting resources. Typically, those programs will just have things available, and it's not a lot of hoops that the parents have to jump through to get connected to those services. And then oftentimes when you get connected to that one service, you can express the need for something else, and they have resources and can connect you to something else, so that again we're fostering that sense of autonomy and independence. Our client is able to go get things. When mom realizes that she's feeling the need to use substances, she's got somewhere she can go to get some help for that. If she's going to keep using substances, she's got somewhere to go where she can get connected to services so that they're not running out of money or running out the things that they need. Because at the end of the day, we can't make her not use. We can't solve the disability issue that the father has. We can't fix any of those things, but we can help them at the bare minimum connect to services and get food and resources and everything else, so that whatever money they have could be going towards rent or whatever they have to pay for their housing subsidy. And sometimes I also like to remind people that our clients' budgets don't have to look like ours. They don't have to pay for everything on their own. It could be that we're teaching people, hey, you've done your budget, this is all you've got left. Maybe it means that you're going to the food pantry every week to pick up that bag of food for as long as you can. And then whatever you would have spent on groceries, it's going towards your rent, or you're saving money that way. Use all the available resources that you can, so that whatever money you have, you can put towards the expense that you can't get covered anywhere else. And a lot of times that's rent. Right. There are typically utility programs. There are typically food pantries. There are, coat drives and clothing that you can get for kids. There are school supply drives. I used to send my clients all around the city to every single school supply drive that happened in August, because usually there would be kid activities. There would be like the doctors or the medical students on site doing physicals and giving out the shots so they could get their health forms done. It would be on a Saturday, so they wouldn't have to take off work. They would go get all the book bags. And I'll never forget, you all, I had one client, she did this circuit of going to all the back to school drives one year, and then she went and sold some of the backpacks. So she had maybe like 20 backpacks in her room, and she just went outside, like literally stood outside the way some people panhandle, and she sold those backpacks, and she made herself like $150 or something, and she put that in her savings account. And she was really proud that she did that, because she wasn't working. She just hadn't found work, but she was able to find a way to creatively make money to do something to meet her goals. And that was really empowering for her. And that's something that she could do, when she's not at the shelter, when she's not receiving services. It's all about helping people figure out how to make ends meet when they can't do it anymore, so that they don't need you, they don't need another program. And that is how we prevent another stint of homelessness. Just teach people how to go do what they've got to do. Right, and that is it for our scenarios. Any questions, anything else anybody wants to bring up that came up in their group discussions before we move on? All right, we can go to the next slide. Now, I'm all about practical tools, right? At Homebase, we do not want to give you some information that you can't take to your desk when you leave and go use it. So we talked a lot about harm reduction. We have some harm reduction resources here. A lot of these are toolkits that come with like actual forms you can use. They come with scripts you can use. They come with ways to reframe situations. And this, again, is all database. So it's not things that are just pulled out the air by somebody who hasn't looked at numbers and really tested it to see what works. But these are just some examples. Those links are clickable. So when you get the slides, you can go through and look and see what's helpful for you. What can you bring into your practice to help support the work that you're doing? The other list of resources, those links are for landlord engagement, because that's a real thing that we've just got to do. And we recognize that everybody is not going to have a housing advocate. Everybody is not going to have, someone whose only job is to go out and build relationships with property managers and landlords. But these resources gives us some good examples of ways that we can start conversation with the programs who are already helping us out and taking our clients. It gives us some resources for how we can really talk to our clients and our participants about ways that they can approach their landlords. It's just some helpful information to take some of what we talked about today and make it practical and useful. And we can go to the next slide. And that's just going to be, again, inviting anybody to ask questions about anything that we've talked about today, anything that's coming up for you. We'll hold space for that. And if you don't have questions, we would love to get your feedback about today's training. Jamie just posted in the chat the survey form so that you can go ahead and give your feedback. We were scheduled till 3, so you have some time to knock this out. Don't leave it and come back to it. You can do it right now while we talk. And yeah, if you all have questions, we're here to answer them. And we thank you all for being here today. If nobody has said it, thanks for the work that you do.
Thanks, Nicole and Alec and Riley, for your training today. This was really great.
Thank you very much. Certainly appreciate it.
Thank you.
Yes, thank you. Very informative information.
Please take a minute before you hop off. Thank you, Nicole, for the signal boost to just take a quick minute and do the survey before you leave. We are also going to send out a recording, the slide deck with all those hyperlinks, and the survey. But your feedback really helps us figure out how to improve these, making sure you all are getting the information you need to best do your good work. So we'll just hang out for a little bit and see if anybody has questions.